So just to put in perspective, right now, 93% of all PPE, the personal protective equipment that our medical first responders need, and docs and nurses, 93% of it in the US is imported, 93%, and 57% from China. And as we sort of think about some of those issues, it struck me there's nobody who could be more interesting to have this conversation with than Debbie Dingell, because I've been privileged over the past decade to have many a conversation with her and get her insights and wisdom about how the hell we got into this mess, but also what are the changes we need after this horrific lesson of not being resilient in the face of this crisis, about how to rebuild our manufacturing strength, but just our resilience as an economy, which of course has enormous implications, not just for immediate health and safety, but for what jobs are available for the 70% of Americans who don't have a college degree. So without further ado, I wanted to bring into the conversation a wonderful woman with whom I've had the privilege of having many of these conversations, and that's Congresswoman Debbie Dingell. So since she for a decade has represented the district in Michigan that's around the side of Detroit, and it's Michigan 12th district. And she has been recently elected to be one of the co-chairs of the DPCC, which is a policy and messaging group that is sort of key leadership in Congress. And Congresswoman, I'm so glad, Debbie, that you could do this.
Thank you, Lori. Thanks for having me. And thank you to everybody that's on this phone call. I want to tell you, first of all, I've been home for 22 days. Today's my 22nd day. And yet I am busier and on the phone more than I've ever been in my career, period. General Motors are here. And when we look at the front line, when we look at the hospitals, our nurses and doctors, Michigan's now third in the country after New York and New Jersey for the number of COVID cases and hospitals being full. And I have for 22 days talked to nurses and doctors who are on the front line. A nurse who's in intensive care nurse writing her will and telling me that I have to promise her that if she dies, I will make sure that her child does not go into foster care, but will go to her former wife. Nurses who are, you've seen the videos on cable across the country. They don't have the equipment that they need. They don't have the N95 masks. They don't have masks. They're wearing masks all day. It's a desperateness that you can't imagine until you're here and you're talking to these doctors and nurses on the front line. And you want to know how we got here. And another thing that's not even being talked about yet is medicine. And the fact of the matter is people don't pay attention to this until you're where we are. But 90% of the medicine, the generic ingredients that we use in this country are made in China. There's a shortage. I could talk about all of this all afternoon, because one of the things that has really become clear is how our supply chain has been shipped overseas, and it's a national security issue for us now. And every single day, I can divide my work into two. It's a lot of stuff because I've been working with the UAW on a lot of issues too. But the fact of the matter is, how do we get those supplies in? And how, I had 3 of our hospital chains came together, and masks that normally cost 50 cents, they paid $8. They bought 10 million masks in. They paid $8.50 a mask and had to pay $1 million to fly it, to ship it to the United States so they would have them last week. When I'm dealing with the OEMs, they're all going into production, but they're still needing supplies. Ford is going to start making I probably shouldn't say this. Could any of you not use this for press? Because I don't know if this is public, but I'm going to tell it to you, but I would ask you to protect me a little. Like, they're going to start making the N95 masks, but they can't start until they get the elastic that they need to make them from China. I'm going to get in trouble. I think I better stop on some of my statistics that are in my head, but this is what we're working all day, how to fight through customs to get those needed supplies over here. our trade agreements have incentivized companies to move manufacturing offshore for years. And it's really hard for the federal government and the states to procure the supplies we need to fight this pandemic. NAFTA 2.0 got rid of some, I call it NAFTA 2.0, got rid of some of the problematic policies and put in place tighter rules of origin. We fought for and we ultimately succeeded in making some solid and tangible improvement to the United States' overall trade regime with the new NAFTA, but we're not done. And quite frankly, it hasn't been implemented, and we have real crises right now.
Can I jump in for 1 second?
You sure can.
Okay, because at that point, as the Congresswoman's talking about the policies, because I want to jump into that, I just want to help also lay out a little bit of the lay of the land, because when the Congresswoman said that all of these jobs are getting outsourced, one of the things I learned from her in 2 years of conversations around the new NAFTA was how much it's not just the trade policies, but also the tax policies and the lack of support for manufacturing. So one thing I just want to flag here is, as folks are thinking about this, now, just to start with, we have a podcast on Rethink Trade that goes through some of this, but just to be very clear, when the Congresswoman is saying that the trade agreements actually helped get us in this pickle, it's objectively the case. So they had investment rules that promoted the outsourcing of investment. You get better treatment if you leave. That's in our free trade agreements. Our deals with countries like China and all of the NAFTA and other countries have no standards for wages, labor rights, human rights, environmental standards. So the companies basically make a bigger profit by doing the wrong thing and have a guaranteed market back. And then add to that these agreements ban Buy America. And we're going to talk a little about what some of the solutions are. And one of the things the Congresswoman's been a big champion of that makes a ton of sense is to help create domestic demand and stockpiles by having Buy American rules that have a basis of creating demand for domestic manufacturing in essential products, so that we create a market for these things being made here so that they can compete with the race to the bottom cheaply made stuff someplace else that otherwise might be what would be bought. So the final piece of this is the tax policy. And I remember many a trade meeting where the Congresswoman said, but it's even worse. It was bad to start with. You used to be able to deduct the cost of outsourcing. But now with Trump's tax policies that he passed, in fact, literally, you get half the tax rate if you leave. So US corporations, US manufacturers, the corporate tax rate's 20%, but if you produce offshore, it's 10%. And Debbie, just because you drilled that through my head, I'm a prophet of your message. I wanted to jump in and share that concrete point, because that's one of the things as we're about to jump to, you're talking about what can be done differently. And I hear you going in that direction. And one of the damn things is to stop doing more of the same. So reverse the outrageous outsourcing incentives in the tax policies, not do any more of these let's outsource jobs as an incentive trade agreements, and please continue.
Well, I mean, people don't understand that we have tax incentives. It's not just, I do want to make one comment about NAFTA 2.0, that our supplier base is really been impacted by what has happened. And we are probably, and I can't believe that I myself am saying this, are probably going to have to postpone some of the implementation of the NAFTA 2.0 because we have devastated the supplier base, but we can't do it for a long period of time. We have to figure out how we're going to support manufacturers in this country. One of them, as Lori says, is by not giving them tax incentives to locate overseas, but we also need to do things. If you look at Germany, Germany's got apprenticeships, and they create innovation clusters, which promotes both domestic and international growth. And what we have to do is promote domestic policies here. So we've got to, what we've got to do is to create things and create the resiliency and the ability to quickly adjust as well. And you can't adjust when our supply chain is a just-in-time supply chain and one that has been shipped and totally dependent on other countries. So when this is over, I didn't practice this one with Lori. I'm going to look at very seriously what we need to do and keep in this country for our national security. When we're looking at medicine, the production of masks and gowns and gloves, all of that. But also when you look at machinery, ventilators are a good example that we've got a huge crisis on not having enough ventilators. And they're very complex. Well, I'm somebody who thinks that the president should have brought in the Defense Production Act 3 weeks ago. We still have not put it into place. Ventilators are very complicated machines that have a lot of components in it. Not all those components are even made in the United States of America. And we've got to really take a very serious look at what we have to produce in this country. Right now, we don't have, if we're trying to get them there, besides the fact that this is impacting the world, and other countries are also, there's a demand by many countries, which is driving up the price. We need to be able, we don't have the time, finding the planes to ship this. We can't put them on boats and ship them over. We have to get these materials quickly, and we need to have that flexibility and that maneuverability. General Motors is going to produce ventilators, but they're not really going to come online or be able to put anything into the supply until early June. Ford Motor Company at the beginning was very honest and blunt and said, we can't do this overnight. Now they were able to find a company that was doing 2.5 a day. That company is trying to contribute to what's being done in America. They're bringing it here to Ypsilanti, Michigan, home of the 12th district, the Rosie, and are going to up production and do it faster than GM. But this is a crisis. These ventilators, even with everybody in America trying to produce them, New York's in its crisis now. We're going to hit our peak in the next 2 to 3 weeks. We're not going to have the ventilators that we need. So we got to be prepared. But the good news in all of this is that we do have companies in America that are trying to produce as quickly as they can. But we also have to look at, we're going to have to explore the whole global supply chain. So when we're trying to incentivize and give support to, say, a 3M that has asked for waiving of liability so we can get those masks there, other countries wouldn't necessarily ship to other countries before they took care of their own country. How do you balance that global responsibility and that domestic responsibility? There are a lot of issues that we got to talk about as we're having this discussion.
I want to just jump in with a little bit of information about Defense Production Act, because a lot of people are hearing about it, and certainly it hasn't been used in a timely manner, but I just wanted to share with folks the pieces of it. So it basically has, it's a Korea War era piece of law that allows a president to declare that there is an emergency. And not only should we, as the Congresswoman said, be looking at our security militarily, but our health security, our economic security. And so the Defense Production Act allows a president to basically declare there's an emergency and have some powers to try and make sure that we have the capacity to produce things that we need to face an emergency. And it has 3 elements. One, the president can order companies to make more of something. 2, they can ask them to retool. So for a company that already was running 2 shifts, the government can say, you got to run 3 shifts. We need more of those N95 respirators. Retooling, so it's what the Congressman was mentioning, for instance, for GM and Ford, that they're starting to do now. And then, and by the way, just to put in perspective, if it sounds somehow improbable if this can be done, to put in perspective the situation of this is what every country is now doing. We just started 2 months late. So when China had, within 2 weeks of the first cases happening in Wuhan, the Chinese government basically ordered that all of their domestic mask production be ramped up, and that a bunch of companies that didn't make masks start doing it. At that point that started, they were able to, China could make 10 million masks per day. Within 3 weeks, they could make 115 million masks a day. None of that stuff was exported. This was a story about a Canadian firm in Shanghai just last week who is still not being allowed to export any of that. So that's the retooling, the making more. And the third thing is ordering. So the government can put in orders, which basically means for a company, they know that they will have a consistent demand for their goods and they can hire more people, et cetera. And, you know, in that regard, there's all this hysteria about export bans, but as the Congresswoman said, in this instance, there is absolute lack of supply. It's not a matter of the US hoarding things to get more money or US companies. There simply aren't enough ventilators being made in the world. Everyone needs to, every country that produces them, and we actually produce quite a few, as does Sweden and the Netherlands. Every country that produces them needs to ramp up. But it really is a matter of democratic accountability that you'd expect a government would have a plan for how to make sure that they had equipment in reserve, had capacity to make it if they needed it. And just to put this in perspective, because the way the press is covering it is that there's beggar thy neighbor hoarding. In fact, if you look at, for instance, what Germany did with the ventilators with Italy, that's what the Defense Production Act allows the US president to do, which is to do a needs assessment. Instead of just immediately having the market decide, oh, they bought it, it goes. It looks at whether there is sufficient supply at home and in the short term distributionally, if some can be spared to another country, et cetera. And our country's totally failed at doing that basic stuff. So just to put this in perspective, because we just ran the data, it just became available at the end of last week. In January and February, with no advanced planning, no oversight by this president, our exports of medical masks to China increased, brace yourself, 1,315%. So 1,315%. Our exports of protective garb, the hats, the drapes, went up almost 500%. Test kits, just in the month of February, went up 58%. So we have totally failed in both keeping the capacity here and managing what we have, which basically begs the question for the Congresswoman, which I have some views on, but she's going to know, she's going to have a better idea. If we had a competent government, what does a progressive mix of policies look like? So you've mentioned apprenticeships, tax policies, change trade policies, increases in Buy America to create a demand domestically. What other things? And you have raised a really important point about meds. So right now, only 26% of US medicine, the combined final stuff, is imported, though like 90% of ibuprofen and 70% of acetaminophen come from China, so all the fever beaters, but only 26% totally, but brace yourselves, 80% of the active pharmaceutical ingredients, the APIs, the stuff you make the medicines out of, come from China and India. So given those kind of horrifying statistics, we've lost all of that. Congresswoman, what do you see, both in the short term, now, as you said, to get us through this disaster, but this disaster makes us have the ability to rethink a lot. A lot of people who used to say, Congresswoman Dingell, Lori Wallach, you guys are protectionists. Why are you so focused on domestic manufacturing? Those are a lot of the same people who are probably saying to you, and they're certainly saying to me, why the hell can't we make this stuff anymore? So what do you
think that we're going to have very serious conversations about what we need for national security. And it goes into many different categories. I think everybody's very focused on healthcare right now, and will forever understand. People didn't used to understand why is it important to have a national stockpile. And my understanding is that the number of generic drugs, ingredients, but that we import to this country is 90% from China. The numbers are astounding. Before we all got locked in our houses, which, by the way, I'm a real proponent of. It's the only way we're going to mitigate this. A lot of us' only job is to stay home, and we need to stay home. I have no patience for people that don't understand the words stay home. But Anna Eshoo had set up, and I'm a member of it, a task force to study this whole issue on medicine, on what we needed to do. And we very much will add supplies to that. But it's, quite frankly, I think that the last few weeks will actually, we talk about the need to look at this. You know, you'll talk about a submarine in our military fleet that you can't get the parts to fix in the United States. You've got to go to Japan, and people hear it and it goes over their head. Or we talk about our electrical grid and where most of the generators are being produced now, which by the way isn't here. And what's the ability, even from a security standpoint, to bring down the grid. I think those conversations will never be ignored again. I think this experience will hopefully have people look at it and understand it, and that we will have a national security discussion about manufacturing, period, and that we will understand the importance of manufacturing going forward, and how do we address that, and how do we include. I don't think that we can, I mean, before this happened, I had raised the issue that when the government was doing bids, we did low-cost bids. And low-cost bids frequently by other countries were lower because for a variety of reasons. I think national security needs to be one of the criteria for any government bid. So we got to look at these issues and figure out how we're going to do it. I do believe that for the short term, it's going to be really hard in this country. And it's one of the reasons that we've got to, I think you're going to see the next bill, Bill 4, will be the care bill on steroids, that we need to put more money, probably extend the unemployment. For sure, the small business loans, we need to make sure that every small business that needs that loan has access. We put more money into it. The hospitals are having liquidity issues because they're canceling their elective surgeries and their doctor's appointments. So where the cash comes from isn't there. State and local governments, that's what you're going to see. We have to do for the short term to keep the structure of a civil society here, making sure that people have food and they are able to eat. But longer term, I think we're going to bring the supply chain back to the United States. We're going to create more jobs, because we cannot be so dependent on other countries. We have to have the ability to manufacture in this country. And I think the other thing that's going to happen, I spend a great deal of my time, it's not a trade issue, but it's a human rights issue. The last 3 weeks, I spent a good portion of each of my days on workers. And Rashida Tlaib and I, in the last 5 days, have written 5 letters to 2 steel companies, to Amazon, to supplier companies, to TSA, because we had workers that were positive at COVID, and within 12 hours of our writing the letter, they got the N95 masks. But I think that workers are going to understand their ability to come together and fight for safe working conditions as we look at the reality of what the last few weeks have been.
So I say from your mouth to God's ears about all of that, and I'm there for you, with you in that fight. But I think it's going to be a fight. And you can see under sort of the classic crisis capitalism mode, team status quo, corporate trade is trying to double down. I mean, what lunacy would there be that while the auto companies are trying to retool to make essential medical supplies, the retailers are actually running around trying to get rid of, saying it will help with the crisis, all the existing, not even China trade sanction tariffs, but waiving the just existing protections that now have some ability for the US to produce trucks, some other goods in the face of unfair trade competition, race to the bottom trade competition. There's literally a huge push right now for tariff waivers. And there's a big push right now by the retailers to basically have a loosening of the rules for inspections of imports. And this is not medical stuff. I mean, for every possible way this government has screwed up,
well, we can't
screwed up. The medical waivers, the tariff waivers, the Trade Representative's Office did in February. So there are no tariffs on that stuff from the China trade fight. So looking at that and thinking about security, I'm just wondering, thinking more broadly, to win this fight, because a lot of companies want to just go back to the same old, it's super cheap, let's make it all in China, it's profitable for us, the same thinking of how they got to where they are. Because I mean, just for folks who haven't seen this, today, the publication of The Nation has a story about how the Army sent out a red alert report, 100 pages in 2017, saying, we are going to have a crisis if we ever get a major coronavirus outbreak in the US. We don't have any of the supply chain. The supply chain for the basic equipment we would need, health equipment, not even military equipment, health equipment. In writing, 100 pages, lots of footnotes. The Army had it out in 2017. And here we are, 3 years later, facing that exact scenario without any policies that helped us basically put ourselves into this horrible pickle. So I'm wondering what your advice is. There are a lot of activists on this call, a lot of union members, about what kind of activities they can be doing, getting ready. I mean, we're going to have you'll be one of the leaders. We're going to have a big fight about this once we get the other side of this crisis. But you know what, it's going to be a fight. I think it's going to be a fight because the companies have gotten very profitable doing the wrong thing, don't want to bring these so-called supply chains, which is just a euphemism for outsourcing, back.
So I would first say to you that now more than ever, inspection is needed. There are a lot of scams out there. I have been dealing and trying to get masks desperately into this state, and we need to ensure that any shipment comes out of China meets specifications, and inspections are more important, not less important. I just want to make that point. I'm going to also say something very bluntly. This isn't a partisan issue on people that didn't step up to what needed to be done. Democrats and Republicans refused to acknowledge what was happening with our supply chain.
Hear, hear.
And by the way, right now, I think we got to be united in fighting this invisible enemy. That the time to look at why we didn't do what we did is after we get through these next few weeks and mitigate people's death and do everything that we can together, which means, I do wish he would bring the Defense Production Act into this, but we need to be together. But I think that there's nobody in this country that has not paid a price for where we're at. I wrote my first letter, and I had to push people. People said, "Why are you doing this?" My first COVID letter to the CDC in January, and Democrats and Republicans thought I was fixating on this too much, that it wasn't going to be the problem that we thought. But this isn't. Corporations are made up of people too, and the customers are never going to be the same. This is something that happens not in 1 or 2 generations, but it's a generational century experience, and people are not going to forget. They're never going to want to have to be locked up, worried about their jobs, worried about their mortgage and their rent, and whether they can eat, and whether they can see a doctor, and whether they're going to live. And I also know, I will tell you that I have lost somebody every single day for the last 3 weeks. I don't know if it's all COVID related. A number of older people have also died, but today my hero, El Kaline, died. And every day I lost a cousin, woke up with 104 temperature on Saturday, went to the emergency room, had a heart attack and died, 55. I don't think the American people are going to forget this. And I think that people are what is going to bring about this change.
Thank you, Congresswoman. I would like to, that is an inspired and sad and powerful place to open the conversation to everyone on this call, with special thanks to Congresswoman Dingell. And now, if I may ask my colleagues at Global Trade Watch to start letting us know what everyone else in the conversation is having to say, and we will respond and ask more questions of you and keep the comments and questions coming.
Thank you, Lori, and thank you, Congresswoman Dingell, as well. Yeah, please put any of your questions into the chat box in the Zoom. That's where we're sourcing them from. If you're not on Zoom, you can feel free to email them to Andy or I, and we can try to get them in there. There's a lot of questions, so we're going to do what we can. And my colleague, Sarah Grace, is going to take it from here with posing some of these questions to our speakers.
Hey everyone, it's Sarah Grace. We have a lot of really excellent questions. Very excited to get to them. Be sure to send more to Ryan, though, like you said. Our first couple of questions I'm going to read together. The first one is from Looser Rocks, and then the next one is from Doug Sutherland. The first question being, where is the data regarding Chinese medical imports from? And then Doug's follow-up question on that is, are these numbers on our export of medical supplies in January and February available online somewhere?
Okay, those are two quick ones for me. So the January and February medical supply data we're about to post. We just disaggregated it. The data came out on Friday. We had to do a couple of double checks to try and figure out what the hell was going on. So yes, it's not posted, but it will be very shortly at www.tradewatch.org, www.tradewatch.org. As far as the medical supply China stuff, so that's a super interesting question, because it should be something we should know. The government should know it to start with, so they can figure out what the hell is a safe balance of domestic versus imported production. The answer, if you've been looking yourself and you can't find it, is because it does not exist in a government-kept sort of organized way. So what we had to do to figure it out is we had to basically go to the consumption data, we had to go to the domestic production data, then we had to go to who imports what by year. We had to try, and the databases don't talk to each other, so you basically have to do it largely mechanically. And it took our data wizard, Sharath, our research director, days to crank through the information, which we will have that online as well. We will very soon have data that shows over time, again at tradewatch.org, the share of where our different critical medical supplies have come from. And some of the tricks, like if you just as a civilian look online and look at where we import things, medicine looks like it's all coming from Ireland. No, that's just because there's corporate tax cheating. They do corporate inversions, and then they fake charge their intellectual property licenses from there. So actually, if you look at the volume of medicine, it's all China, then India. If you look at the value, which is what you would normally look at because volume's really hard to find, it looks like it's Ireland. So we're going to have all of that data online soon, but I mean, one of the things we need to do as we're looking long-term is we need to be tracking where these supplies are, how much demand we have relative to how much supply and where it's coming from. Because right now it's the wild, wild west. And you basically need a PhD in data to even find the answer of what the problem is, much less the solution.
All right, ready for next question? From Alex Dieter, one argument often posed against infant industry protections is that protections will widen the technological gap between domestic and foreign products. How does this argument hold up regarding certain quote unquote essential industries as PPE, ventilators, etc.? And how else might an emergency stockpile be compiled for the next crisis?
Congresswoman, would you like to jump in on the question?
Well, I didn't hear the beginning of it. What was the beginning of that question?
That an argument is often posed against infant industry protections, that such protections will widen the gap between the domestic and foreign products. And Alex is wondering how this argument holds up against certain essential industries like PPE and ventilators.
And if you want to think more about that, I can answer part of it.
You go ahead and then I'll add. I mean, I think that you've got to protect essential industries, period. But go ahead.
Well, we're not talking about infant industries.
No, we're not.
So that's part of it, that's development theory. And there is some evidence to support that supposition. And there's some evidence to say, no, it's not true, because infant industry production often just jumps ahead of whatever previous technology because the protection allows for innovation that is not just race to the bottom, cheap wages innovation, but better product innovation. So the data in the literature on that development infant industry question, just to be a total trade nerd, is mixed. However, what we're talking about, the Congresswoman and I, is not infant industry protection. What we're talking about is setting up a system that's no longer these really attenuated supply chains that are too long, 63 days normally from an order going in to an N95 mask getting into a US hospital from China. 63 days, too long. Sole source. Right now, there are too many products that are only made in 1 or 2 countries. People there just get sick. Skip export controls. People get sick and everyone doesn't have it. You need redundancy for resilience. There's a reason why nature has redundancy. It's resilience. And then as well, just as far as the political element of it, which is, if you as a government are responsible for the people who you are accountable to, you're going to look to their needs. There's certain things, as the Congresswoman was saying, and I agree, that you need to have, not just for military security, but for health security, for income security. There are things you need to have in an economy that's just not a total open market. And it's not just trade protection. There are a whole set of things like the social safety net that we don't have that I hope also will be revisited for its enormous gaps now revealed relative to the experience people all over Europe are having in the same exact condition of being locked down as far as their health care and having some basic income to support themselves through this. But all of that goes to really thinking about what are some things that as a country for our well-being. Obviously, we've just learned the hard way, certain key medical supplies. But what else for our physical infrastructure, for instance? What key elements of iron and steel do we need? And as the Congresswoman said as well, for military purposes, but not exclusively. What are areas where we need to have more redundancy in the global economy so that, for instance, right now, Purell is arguing they can't produce as many pumps as they want because they went to sole source supply of the key spring in the pushy thing in China. So when that firm, which has had a huge sick out of people with COVID, can't supply the spring, the Purell manufacturing, even if it were able to be flown here as compared to take 60 days by ship, is affecting all of us. So we need redundancy. And that's a very different way of thinking. You think about the goals of your trade or your economic policy, and then you go backwards to what part of it's traded. Of course, there are benefits to expanded trade, but that's part of a tool that's about meeting your goals. Right now, we've had trade uber alles, more liberalization, more offshoring, always a plus, without thinking about what is the purpose of the economy. It's to serve people. Congresswoman.
To add to that, one of the concepts we've gone to in the economy is just in time. So that 63 days was adequate for normal times, and hospitals didn't want to invest in the capital outlay until just in time. But that's also how it's become in companies. When Wuhan got hit, the auto industry was dependent. It had dependent on some of the things that were being manufactured there. There's a lot of discussion now about Mexico has been more lax about coronavirus and COVID than the United States, most places. There's still some places that probably are not as stringent as they need to be. So how do you bring the economy back up? But because we have become so dependent on components that are made in Mexico, that's going to impact our coming back up too, which is why we really need to look at that supply chain and what needs to be made here. And that's and Lori was talking about the different industries, but the grid is, so just think about what's giving us civil society right now, that essential structure. And if people feel safe, which they don't feel healthily safe, but so far we have not had riots or had anything like that, but they have food. So we need to keep our food chain and suppliers up. and we need to make sure the medicine's coming, and that for the moment is okay, that we're seeing shortage of supplies. But if our grid went down, people didn't have electricity, we didn't have internet, and we need to, by the way, when we do our infrastructure bill, I think we'll finally be able to get broadband into areas that the less, those who have lesser income in rural areas will also have access to it. We need to address other issues, like as our kids are having school problems, how do we teach those that don't have access to computers and broadband? There are a lot of issues that we're going to have to look at the, I know this is a trade discussion, but there are a lot of issues that the disparities, the income and the economic, and the income, economic, social, and health disparities are being very much magnified as we go through this.
So maybe if we could just have two or three questions as a bundle, so we can do one more round. I don't want to hog the Congresswoman's very valuable time. And then we will say goodbye, suggesting everyone tune in to the Rethink Trade, rethinktrade.org website, the podcast, because this is really an opportunity to fundamentally rethink how we reshape these policies and practices to be more pro-people, pro-planet, secure. So Sarah Grace, some more questions, some more comments?
Yes, absolutely. What efforts can be made to work across parties in Congress and through campaigning with some of the emerging Republican protectionists without echoing some of the more xenophobic rhetoric about the Chinese people? This question comes from Hal Conte. Excellent one.
And let's have a couple more.
Couple more? All right, you got it. From John Leish at Carpenter Local 174, question for Congresswoman Dingell. Is there some way to draft language for the fourth support bill that creates a Made in America supply chain? And how do we use this crisis to fight for greater justice in our trade bills? And then Maria Curie asked if Congresswoman Dingell, could elaborate on what she meant when she said NAFTA implementation may have to be postponed because of a limited supplier base.
So let me just jump in with Maria's question for the Congresswoman. Why don't you, Maria's a reporter, why don't you call her office and try and set up a interview for that, unless the Congresswoman wants to answer that question for the reporter. And with respect to the other two, a lot of what the Congresswoman's been talking about are the pieces of the Made in America supply chain, but it'd be really interesting to think about both the political partnerships that are possible and the pieces of policy to make for a change. So I'm going to turn it back over to the Congresswoman.
So I think it's really important to work across the aisle. And as Lori knows, I worked very hard on TPP and NAFTA. I actually think Bob Lighthouser in many ways has been a better trade representative than several of the Democratic ones that I have worked with, to be perfectly frank. And I think I really do think the reality of what we are living right now is getting people to understand in living reality the points that we have been trying to make about what is happening to our trade policy. And I'm already talking to my colleagues in Michigan about what we are going to do about this, to members of the Energy and Commerce Committee, to my women colleagues across the aisle. How are we going to make our nation more secure? Because we have been left vulnerable by these trade policies. So I'm already working that. Excuse me, it's allergies, not coronavirus. To the other, I feel very bad because I'm really very concerned about some of the demonization that has occurred because, in my first letter, you will recall that this was being referred to as the Wuhan virus before it got a formal name of COVID-19. And the kind of targeting of the Asian community that we have seen is simply unacceptable. It is, you've seen how fast it spread. most of us are catching it from community spread right now because quite frankly, there are a lot of stupid people out there that don't listen to what they're being told. And they think if they go out, they can still go and do things. They can talk to people, they can socialize with their friends, and they don't understand that they are part of the mitigation responsibility. So I think we got to be really careful in terms of not demonizing anybody. But I really do believe that the reality of our own national security. And when I talk about national security, many of you may see that's from a military standpoint, but I look at it as much economic, protecting our grid, protecting our healthcare, protecting those basic, the things that make us a civil society, and protecting our country and protecting our communities in ways that we need to. Those were 3 questions, and I can't remember what else I was supposed to answer in there, but
Sounds great.
Okay.
That was great. And the only thing I would follow up by saying, given there are a lot of activists who are on the line, it is clear that this is a horrific crisis. And it's right now, everyone's focused very clearly on trying to get through it with the fewest casualties and trying to stay afloat economically. And that is what all of us in the short term will be needing to think about. As we're doing that, the trade status quo team, the big companies, the big import retailers are trying to basically double down and pretend that they haven't helped create this mess. And I think one of the things we can all be doing in the short term as we're all cooped up is to be sharing with each other the insights that you get from a webinar like this, or a podcast, or if the Congresswoman writes an op-ed, or basically helping people understand that this is a mess we got ourselves into with bad policy choices, and we can get ourselves out of it vis-a-vis the fragility we face in trying to respond to the crisis, not the health, not the actual virus, but our capacity to deal with it. So in the short term, a big piece is to actually help people connect what they're experiencing, as the Congresswoman said, because it is transformational, to what the real causes are. So it's not demonizing our Asian American fellow Americans. So it is not trying to blame a finger at this one or that one. There'll be plenty of accountability afterwards about balls dropped and readiness not in place. But in the short term, basically helping folks understand this was a lot of very greedy companies who help rig the trade and tax rules, and the choices made by some politicians who need to get a different path is an opportunity in a way to have more and bigger potential partners in the change. We're only going to get this done if we continue to grow those who understand and are demanding the change. So number one is to educate, outreach, and to not exclude folks who you might otherwise, that those relatives who, if you were sitting together for a Passover Seder or Easter dinner right now, who you might wish wouldn't talk about politics, those are the folks to just talk about this unifying experience and what is really at the root of why we're up such a crick right now, and that there are things we can do to make it different. And then the policies, basically it's a smorgasbord, right? You have to look at what the goal is. As the Congresswoman said, the way she thinks of national security is what I kept emphasizing, because I knew that's what she was saying, but a lot of people think about it as military when it's economic and it's health and it's the infrastructure. And if we want to have more equality, and if we want to be able to plan forward for a planet not melting down, if we want to have more basically reliability, resilience health-wise, what does that need? It needs a new trade policy that puts the goals first, not basically the corporate race to the bottom. How do I make it cheaply in one place? It requires different tax policies that actually do not incentivize the wrong thing, but reward it, and that penalize the outsourcing. So companies actually get penalized for doing the bad thing, not get a tax break for doing it. It requires changes in the social safety net so that, as we've all talked about, as this whole country's having a discussion, the prospect of this economic disaster doesn't become a healthcare disaster for the millions of people who, when they got laid off with this disaster, are also now losing their healthcare. And then finally, we need to also improve training and investment in, once we have the plans, once we as a country, as the people who are living with the results, decide what it is that we want to prioritize, we need to help make the transition. And it's not, this crisis is one that has come rapidly, but the one that's been creeping on us that is a similar one to which we need to adjust is climate. And this moment, in a perverse way, is sort of a horrible wake-up call to the structural changes that are going to have to be made, as the Congresswoman said. And, you know, we can do that together, but it's going to be a fight. And so I just want to give the Congresswoman one last opportunity to say anything, and then I will close us out.
So I think I'm more hopeful than Lori. This is a point I make a lot. Suddenly the whole world is dependent on people they don't think should make $15 an hour. And I think the value of human beings is suddenly being appreciated. And that if we didn't have that Amazon warehouse worker, or that Amazon driver, or the person stocking the shelves in the grocery store, or helping to at the checkout at the grocery store, if we didn't have the mailman, if we didn't have the nurse, who are always underpaid and underappreciated, that the frontline workers are the people that are keeping us alive and in a community. They are the heroes. And I'm hoping that we're all understanding who our heroes are, and that they are going to be the winners when we come out of this, and that we're not going to have to beg anymore, but people are going to understand their value, and that the policy changes we need to see are going to be policy changes that we can actually get through.
And we are going to close on that note, because I believe in that too. I think that is true. I just think it may take some organizing and fighting to get that vision delivered. Either way, a thing everyone can do is to stay on top of the latest developments and share the word. Thank you so much, everyone, for taking the time to join us today. Special thanks to the Congresswoman, who is in the middle of it all and is extremely busy. We really appreciate your time and your wisdom and your thoughts. And see, everyone, I told you, when I thought about Debbie Dingell, I said, I got to share what I get. It's a privilege in talking to her with more people. So everyone got to have a little bit of Congresswoman Dingell's time and wisdom, which I feel very privileged to enjoy on the regular. And so everyone now gets a little bit of it. And thumbs up to her so she can see, because people's audio is off. I've seen some clapping. I've seen some waving. Thank you, Congresswoman. And with that, I will thank everyone again who participated. Please, if you're not signed up for rethinktrade.org, go to the website, sign up. We're going to be sending out continuing alerts, and we're going to be making sure everyone has the best stuff to help educate people and get engaged. With many thanks to all, and special thanks to Congresswoman Dingell. Thank you all for joining us, and stay healthy. As the Congresswoman said more politely, stay the F at home. Bye all.